Thank you, Dr. Fung. Our third and final presentation for this session is titled Public Health Program Development in North Korea. It's going to be presented by Malcolm Gillis of Rice University.
Dr. Hunt, see me about the Atlantic Foundation. Okay? You can't apply. I have, by the way, spent several pleasant days on Halong Bay. So my co-author, David Hilmers, is in India working on problems of child malnutrition. Both David and I are concerned with human security. And doing this, sometimes when you try to promote human security, sometimes that means you must engage with people who don't share your values. And that's what this is about, too. And by the way, I'll be saying the name DPRK several times. That is the preferred Democratic Republic of Korea. That's the name that the North Koreans prefer. I'll use them interchangeably, North Korea and DPRK. Okay? So this is one more example of a long history of collaboration between Baylor and Rice. Both are members of the Texas Medical Center. Both the authors of this paper have been involved in assisting the Pyongyang University of Science and Technology. We call it PUST for short. Hilmers as a member of the advisory board and myself as one of 3 trustees. What PUST is a privately funded institution that bears close resemblance to another private institution in China called Yanbian University of Science and Technology, say UST, the initials. And it also bears a resemblance to 2 other private universities modeled after Rice University. One is in Bremen in Germany called Jacobs University Bremen, and the other is in Vietnam near Ho Chi Minh City called Tan Tao University, which I also helped found. Construction for the PUST campus began in 2005. We had to import all the bricks from China, believe it or not. Very expensive. And it was largely completed by 2010. Now that we have 17 buildings on campus, including an administration building, an R&D center, as well as dormitories. Dormitories now for both students and faculty. There's a view of the PUST campus from the air and of our different buildings. Okay, all privately financed with funding from the United States and South Korea. Faculty at PUST have been drawn from South Korea, the United States, and several European nations, especially Northern European nations. The founder and leader of the school is a truly remarkable individual, Dr. James Kim, who's a U.S. citizen. He also founded UST. PUST, like JUB in Germany and Tan Tao in Vietnam, is a residential university wherein students are housed on campus. This is a very rare occurrence in Asia and in Europe, not to mention North Korea. The student body is all male at present. We hope that will change over time. In 2012, the first PUST students were accepted for overseas study in Britain. So we began in 2010 with 3 schools: electrical engineering, international finance and management, and a school of agriculture. And in 2012, and the reason I'm here today, the opportunity arose to start a life sciences school. We do this with the understanding that the number of health professionals in North Korea, the DPRK, the number is adequate, but they severely lack training in modern medical technologies and techniques, not to mention equipment. So the DPRK government has asked PUST to establish schools for health professionals in public health, medical with emphasis on primary care, dental, and pharmacy. And curriculum planning is underway. The partners we've identified already with experience in global health and startup medical education. The U.S. schools include Samford University, not Stanford, Samford, Rice University, Baylor College of Medicine, and Duke University, and in Britain, St. Andrews University. The major problems that we're focusing on in the DPRK include cardiovascular health, malnutrition, and especially liver cancer. And the government of North Korea has requested assistance in trying to understand the prevalence and do something about the treatment of cardiovascular disease and liver cancer. And we have tentative approval now from the DPRK Health Ministry to study the prevalence of hepatitis, which is, of course, as you know, a likely cause of most liver cancer around the world, but especially in the DPRK. The incidence of liver cancer in North Korea is the highest in the world. Okay? This is an uncommon request from a government that, to say the least, is not accustomed to collaboration with private institutions, domestic or foreign. They ask for this. And the POOS TMC Research, Texas Medical Center, will shed more light on the reasons for the very high incidence of liver cancer. And if it's likely that hepatitis B is confirmed as the major culprit in North Korea, this could help convince the government health authorities to mount a vaccination program similar to that in China, which is very comprehensive. It has been going on for decades now, or at least a pilot program such as that initiated for 19,000 people in rural Vietnam in 2012. So we expect also that the second aspect of this joint program will focus on malnutrition and malnutrition and other things. It's generally accepted that there are very high rates of malnutrition, especially among children in the DPRK. The statistics on the prevalence of malnutrition are regarded, the official ones, are regarded as unreliable, and the government denies any widespread hunger. But we know there have been famines, and estimates of deaths from famines in the early 1990s ranged from a low of 220,000 to a high of 3.5 million. Okay, it's a serious issue. Now, JUST, our partner institution in China, has set up a feeding program, and that has the tacit, not the official, but the tacit approval of the North Korean local governments. There are about 35,000 feeding programs. There are about 35,000 children in orphanages in the northern provinces and around Pyongyang, and they're being fed by programs organized by consultants at JUST in China. And the products that are being used include several fortified complementary foods designed for younger children. These are all analyzed at Baylor and check out well. The results, we believe, will help to improve the nutritional quality of these foods. So what are the benefits or the possible benefits? You know, we don't really, we know that this thing could end at any time, but we've been left alone, mostly. But POOS provides a window to the West. It gives DPRK students an opportunity for a first-class Western-style education, and it provides an opportunity to expose the leaders of tomorrow to Western thought. In health initiatives, the development of health schools will train new health care professionals with modern technology. It'll improve the health of the population through research into chronic diseases such as cardiovascular disease, hepatitis, and liver cancer, and the prevention of these diseases. It will improve, we hope, the nutritional status of young children. The most lasting benefit may be in terms of cooperation and understanding and reduction of tensions between our two countries. Scientific diplomacy sometimes succeeds where other means have failed. So that's all I have to say.
We do have time for a couple of questions.
Yes?
Remarkable. I'm just very interested if you can tell us, how did you get government approval for all of this?
Oh.
Was it, because it seemed as if you emphasized the China connection maybe and
It's a
de-emphasized the U.S. connection?
It's a long story. And I'll tell you, but it requires a lot of patience, which I usually don't have very much of. Oh, well, it got started years ago with Dr. James Kim being arrested in North Korea and being sentenced to death. And they changed their minds. It's a long story, and it's a story you've got to be persistent. But you know what happens? If people think you're trying to help, they'll put up with most anything. If they think you're trying to help. All of you young people, remember that. You can get away with most anything if you're trying to do it, if people think you're really trying to help. The second question?